All right, so we have a motion from Mr. Pilarski. Is there a second to the motion?
I'll second.
All right. So we have a motion and a second by Sheriff Mullen. So we can have some discussion now. I guess I have a question because the motion indicates that the board would be able to observe the training. Warden Harper, could that happen? Could the board come and observe the training?
Absolutely, Your Honor.
All right. So I'm going to go down, and Ms. Hallam, you're first on the list anyway, so you have your hand up. So Ms. Hallam.
Yes. So my first question is, I just want to clarify under what authority Mr. Pilarski is introducing this motion, just for the record.
Well, he's representing Mr. Fitzgerald, who is a member of the board.
So that's what I wanted to clarify. He was introducing this motion as the proxy for County Executive Fitzgerald.
Yes, I would assume you can clarify that, Mr. Pilarski.
Yes, that's correct.
Okay, thank you. And then my next question is, we actually do have videos that are online and from other facilities that show this training in other facilities. I was wondering if it was possible if we show that now as opposed to delaying this, because from my understanding, this training has already started. And so, Mr. Pilarski, can you confirm whether or not you know that this training has already started in the jail?
Yes, the training has started.
Right. So this is not about delaying a decision on something that hasn't yet started. You are asking this board, who is responsible for overseeing the health and well-being of the folks incarcerated in the jail, to allow a training to continue.
I'm asking that you delay stopping the motion to stop the training because I believe it's in compliance. And again, I believe what you're seeing on the internet is not indicative of the training that the jail is receiving.
Well, we were getting ready to ask Mr. Garcia some questions about what we have seen ourselves when you introduced this motion, so I just figured it was appropriate. I have one more question for you, Mr. Pilarski.
Ms. Hallam,
There was the invoice for this training that was sent to the county for payment. Did it or did it not say on the invoice for payment for this training that this invoice was approved by the jail board?
I did not see the invoice. I didn't see any invoices.
Okay, so I will tell you then that the invoice for this training said that it was approved by this board. There had been no care in the world about what this board thought was appropriate, what training this board thought was appropriate in the jail that we oversee, until the media started reporting on it, until this same training in York County, another one of our counties in Pennsylvania, has been blowing up in local media there as well because of this same contractor. So I'm just wondering why you decided today to introduce a motion in regards to the Seesaw contract when, one, the training has already started, two, the invoices have been submitted to the county for payment saying that they were approved by this board, which they were not, and three, whenever I am assuming that, but I guess I will ask, did you know about the Seesaw contract prior to this meeting?
Did I know about it? Yes, I knew the training started, and this would be the appropriate venue to make such a motion. You asked why I made it today. This would be the only appropriate venue that I have to make such a motion.
Okay, so can I ask why you thought this was the appropriate venue to make this motion today, but you did not think that this was the appropriate venue to present the information on the Seesaw contract prior to today?
Because there was the point is that all the misinformation that's out there, and there's another motion that to me may at this time render itself moot if we just go and watch the training and see it and make the best informed decision, as opposed to believing what we see on the internet. Let's go see for ourselves. You go see for yourself. You have the best. You'll have the information ready. You can ask all the questions you want. You can go see it, and you'll make the best, most thoughtful and informed decision, as opposed to believing what's on the internet. I mean, with all due respect, if you Google all of our, I've Googled everybody, including myself. There's a lot of lies out on the internet. I can tell you that about all of us. So that doesn't mean what's out there with Mr. Garcia is true. Let's take the time, go see the training. Let's see it for truth. Let's touch it. Let's feel it. Let's ask those questions. I believe that's the most appropriate time.
All right.
And that's what we are here in this meeting to do today. So I look forward to being able to ask those questions of Mr. Garcia himself. So thank you.
So we have lots of hands up. I was just going to go down the list, but I think Judge Lazare had her hand up next, and then Miss Moss. So we'll do Judge Lazare and Miss Moss, and then I'll go back through and get everyone else because I think other people have questions and comments. Judge Lazare.
I was just wondering if I could offer a friendly amendment to the motion. Because I do think that we should go see the training, and I do think it's important for us to see the training. But I would like to offer the friendly amendment that the training is paused and stopped in the jail until we have the opportunity to go and see it and be able to assess it for ourselves. So instead of Mr. Pilarski's motion, which just says let everything continue and then we go look at it, I don't have a problem with going to look at it. I think it's probably a good idea for us to go look at it. In fact, I agree it's a good idea, but perhaps we could pause the training until we've had an opportunity to see it and then discuss it and vote on it. So I would offer that amendment. He doesn't need to accept it, but that's the amendment that I offer.
With all due respect, my only comment would be we don't have to implement it if that's the case, but I don't see the necessary benefit in pausing it. We would want to make sure we finish it as quick as we can so we're in compliance by December 6th. I mean, we have a very short timeline here, and if this training is not an option for us, we're not really left with much time to go do some other training. So
you are then not accepting my friendly amendment?
I'm sorry, I am not.
Okay.
Miss Moss.
Well, one question that I have is before the seesaw or whatever organization would be there would be called in, I would like the warden to explain what his de-escalations he does before it gets to that. If he'd be willing to tell us, because he already does do some de-escalations. Is that possible?
Yeah, I can answer anything you would like, Jill Oversight Board.
Well, I'm asking you to explain what's the process of your de-escalation before a seesaw or another entity, if there's one, that comes in that has to take over when you can't de-escalate.
So as we said in our presentation, the first thing that's going to happen is a supervisor is going to go to the cell to ascertain what is the inmate's issues. The main thing we want to do is try to address the individual's issues before we try to use force. Everything is video recorded. So when the supervisor goes to the cell, he's going to be trying to ascertain, and everything's video recorded. If the inmate is still non-compliant, then medical and mental health is going to come and try to ascertain what is your issue. Try to resolve the issue before seesaw is called. When seesaw is called, they're going to come and they're going to ask the same thing. But before seesaw is called, they're going to have mental health come and brief them. Is the inmate on any type of mental health medication? Has he been taking his medication? Does he have a mental health issue? Once seesaw get that information, they're going to go to the cell and try to de-escalate the situation also. If seesaw feels that mental health needs to go back and reassess the inmate, mental health will go back before any force is used. So at least on 3 occasions under video, the de-escalation techniques are video recorded.
Thank you.
All right. So Ms. Klein, do you have any questions? It can be for Warden Harper, Mr. Garcia, Mr. Pilarski, or a comment. It doesn't even have to be a question. You're on mute. You're on mute.
Thank you. Sorry. I would ask if I could put in a friendly amendment, which would be that we pause the training until we have a chance to look at it. But where I'm going to be different is I would like the jail to consider other options so that we're not caught behind the 8 ball when it's time for the
Got to say something. Yeah.
Resolution to take effect.
Judge Clark?
Yes.
Can I speak something on behalf of that? So I just want to say I am concerned about even the possibility of us relying on what we are shown in a presentation if we come to the jail, based off the fact that evidence has been entered into court hearings across the country, videos, surveillance videos from corrections institutions with this specific training being used, I would rely on that more than I would, oh, the jail oversight board's here today, let's show them how it's done, you know? So I would like to ask that that be allowed to be showed during this meeting, since we've already seen Seesaw's presentation and in the jail's presentation on this training. I would like to ask that we quickly show a clip from a facility with a video of this training that has already happened.
Are you sure that this is the same training that we're receiving at the jail now? You're positive it's the same?
I am positive that is the same provider of training, and that is what I'm concerned about, is the provider of this training. I did not see a bid go out for this sort of services. This was a single source bid that was targeted specifically to this provider, and therefore that makes it eligible for us to look at what this provider has done and what their track record is. If this would have been opened up to other entities to submit a proposal for a certain sort of training, but that is not what the county did here. The county entered a single source bid, only going to Seesaw, not opened up to anyone else. So I do think it is relevant here that we look at the type of training that this entity does. So Judge Clark, would you mind if we watch the video of that, please?
So, well, I'm going to ask defer to the board as to what they want to do. So hold on to that thought. I thought the warden was going to say something in response to Ms. Klein's request for an amendment to the motion. I could be wrong. I thought the warden was starting to speak.
I mean, I think Mr. Pilarski has to decide whether he's accepting that motion, that amendment.
Well, that's true.
I thought there was still discussion.
But I thought the warden was going to say something in response to that. Could be wrong, but if I thought he was before I asked whether he would accept the amendment. Warden, were you going to say something? You don't. If you weren't, that's fine. I just thought I heard you starting to speak.
You know, Ms. Klein asked, what are other options? So I'm gonna ask you, Ms. Klein, I'm gonna ask the whole board. You saw the options that we have. We're getting our chemical agent taken away. So if the Corrections Special Application Unit is not allowed to work, the only option I have is to send 5 correctional officers in a cell to restrain an inmate. And as I said, that took place. We got away from that. In corrections, in modern correctional theory, we got away from that. So I'm gonna send 5 officers in the cell. That inmate is going to get hurt, and my officers are going to get hurt. That is the only option. And that's an option that we do not want to do.
All right. Mr. Pilarski, do you want to accept the amendment, or?
I'm sorry, could Ms. Klein repeat it in full?
Sure. My amendment would be to allow the board to see the training. While that is happening, the training is paused, and also the jail looks for other providers who I know have followed when Seesaw has been removed from contracts. Other providers have gone in to provide training.
And again, with all due respect.
Yes, go on.
I'm sorry, with all due respect, my problem again with pausing is all the other trainings that were investigated include items that can no longer be used because of the referendum. So there isn't a training out there that includes, that doesn't, that doesn't eliminate those items. These eliminate those items that we can't use. This training makes us compliant with the referendum. Everything else that was researched, first, if you go to the ACA or NIJ, the first things they're going to tell you is use pepper spray, use leg shackles. They're 2 of the top 5 things in terms of less lethal uses of force. Those things can't be used anymore. They were taken away. We continue to take tools out of the toolbox of the Allegheny County Jail. This is going to have an adverse effect of what we're trying to do here. I mean, according to the corrections professionals, I went and did my homework on the NIJ and the ACA websites, did some other homework. Again, speaking to the other professionals, they believe it's going to have an adverse effect if we continue to take tools out of the toolbox.
May I ask an additional point of clarity? This is Chief Williams. Both motion amendments have asked for pausing of training, but also allowing for observation of said training. So I'm a bit confused about how we achieve both objectives.
Well, I was thinking the same thing. That was going to be my question. If we pause the training, then we can't watch the training. I think what Mr. Pilarski is saying, to continue the training, we watch it, but they don't implement the training until the board says they can or not, but they continue with the training. I think that's what his point was. All right, I'm going to come back to.
Can I have him clarify that is his point, that they would continue the training but not implement it until we've had a chance to watch it?
Or until such time December 6th comes, if we haven't made a decision prior to December 6th, I think we're left with no options. But yes, that was my point. You go see the training, it wouldn't be implemented prior to any decisions or December 6th, since that is the deadline.
So what's our guarantee that we'd be allowed to watch it before December 6th?
I think that's up to us, Ms. Judge Lazara, that we would have to commit to going, or at least a certain number of us would have to commit to going. And I don't know that we all have to go on the same day or at the same time. So I think we have to commit. So this is September, so we have.
Right. You only got 4 days.
October and November. So that's.
When's the deadline date?
December.
Oh, December. Oh, okay. I kept sure you were saying September. I'm thinking, how are you going to do that?
No,
December.
Okay.
Judge Clark, can I ask for a point of clarification on that? So the training that's being done currently, is that training being done on actual incarcerated folks in the Allegheny County Jail involved?
Can you say that one more time, Ms. Hallam?
Yeah, so the training that is happening currently, is it being done with the participation of actual people who are incarcerated in the jail right now?
The training that is being conducted now consists of the correctional officers roving the jail to get the experience that they need to handle these situations. So yes.
Okay, so that's what I think they're asking in their amendments, is about pausing the training. I just also have another point of clarification, because you keep mentioning the referendum and how it took tools out of your toolbox. First of all, I don't think that any jail should have had those tools in the toolbox in the first place, which is why an overwhelming number of residents and voters in Allegheny County voted to remove them. But you kept saying that you had nothing else to use, and I just wanted to clarify, Warden Harper, do you still have tasers in the jail?
Ms. Holland, we sure do have tasers in the jail, but those of us that know anything about tasers can't go through a door or through a food slot when an inmate is locked behind a door. So I'm not going to open up the door and use a taser, putting my officers in jeopardy. So yes, we do have tasers, but correctional experts know that tasers are not effective all of the time, Ms. Holland.
Okay, and so I guess I'm confused, because in the video that you showed as an example of the seesaw practice, they too are opening the door and going inside. So can you clarify what is the difference?
The difference is that they have the mechanisms and the equipment to protect themselves if something should happen, and they're trained to use those options. A regular correction officer with just the taser don't have the specialized training or the equipment to keep themselves and everybody else in the cell block safe. So Seesaw is trained to handle that situation like that and have the equipment to accomplish the mission with minimum people getting hurt.
In the Kel-Tec shotguns that are a part of this training, how do you use those through a door?
Excuse me?
The Kel-Tec shotguns that are used in this training, you were talking about you can't use a taser through a locked door. How do you use the Kel-Tec shotguns through a locked door?
May I answer the question? Ma'am, the Kel-Tec shotguns, when you're talking about a door, and I want to just kind of address one little thing about the tasers, because a number of inmates use mattresses, they use uniforms as barricades, those probes have a tendency of not sticking or connecting. So what we want to be careful for is also that when we deploy any type of taser, the effectiveness, number one. Number two, the safety of the officer and the inmate. On the Kel-Tec shotgun, that gives us distance. In other words, I don't want to be on top of an inmate, trying to have him cooperate, because it's going to be very quick, as you know, with violence. I'm sure everybody's aware that the human response to closeness, okay, automatically instills a number of different things. But if I can do a standoff from a distance, I have the chance of using my voice, my brain, and hand signals to try to get the individual to understand, I'm not here to hurt you. I just need to change your behavior so that we can safely secure you no matter what. So we have tools as options. It's just like a police officer in a street or yourself. Just because you have something doesn't mean you have to use it. I'm sure you have a nice car. It doesn't mean you have to go super fast. It just means that you have an option if you want to pass it on a car. So I hope I just want to clear that up. Just because we have tools to protect us, tools to be able to deal with barricades in different situations, it doesn't mean we have to use it. We want to allow them the option of being able to look at that inmate and deal with them accordingly, but preferably at standoff distance. Thank you so much.
Right, so my question specifically, if you wanted to answer my question, Mr. Garcia, my question was specifically, since it was referenced that tasers cannot be shot through locked doors, my specific question was, how do you plan to, if needed, use the shotguns through locked doors?
No, ma'am, I think when you say through, we don't shoot, we can't, it's impossible to shoot anything through a solid door. We have to open the door no matter what. But
yes, thank you, Mr. Garcia. That was my point. The door has to be open no matter what. Thank you very much.
Thank you very much. Sorry.
Sheriff Mullen, do you have any questions or comments?
Yeah, I believe strongly in what the warden's doing, and everybody knows he's done a good job. It's been proven by, some people saying that. And I think if he wants to use that training, I think that's his option, because he'll pay for it if the training doesn't work out. Maybe there should be a limit to how long we do the training and to see if, in fact, that it's still good training.
Judge Clark, I want to speak to that. It's actually not the warden who will pay for anything that goes wrong in this training. It's the taxpayers of Allegheny County. Recently, a case just settled for $10 million where their corrections expert found that this specific training with Seesaw contributed to the death of a man named Jamal Sutherland in South Carolina. And so it is not the warden who will pay. Nothing will come out of his pocket when something goes wrong, because it will be the taxpayers of Allegheny County who will be paying when something goes wrong.
Thank you.
I think it's appropriate for Mr. Garcia to respond about the allegations of Jamal Sutherland.
Thank you.
Good. Thank you so much. I'd like to just clarify something. First of all, it's sad that Mr. Sutherland had to die or passed away, but I want to make this board aware of one thing. In 2018, as you'll find in a 77-page report, the SOG unit, the organization that I was involved with, we stopped our contract. We fulfilled our contract in 2018. In 2019 of March, I sent a letter. We have all the evidence. It's been verified that we will not sign with the Charleston County Sheriff's Office. In the report, it also says that the SOG, that the agency took its SOG from 2019-2020 and started their own training. I want to get established two very important facts. One, one of the officers who was involved in the Jamal Sutherland case started a 6-week program, but was dismissed on request, or what we call did not graduate the program, left in the second week of a 6-week program because he didn't qualify. The other officer was not certified through our organization since 2017. So we are 2 years removed from that, number one. Number two, neither of those officers were certified by us. Number three, they had another supervisor come in who brought in traditional cert training and mixed it with a SOG and still wear the t-shirt of SOG. That does not represent who we are. It would be like buying a beautiful Mercedes-Benz. You have an engine that you removed out of it, and then you put another engine in it, and you still call it a Mercedes-Benz, but it doesn't work the same way. So we have no culpability. We have not been named in any lawsuit. We've cooperated fully with the FBI, who took all of our information that we provided to them. We changed the mental health program, but everybody involved in the Jamal Sutherland case had nothing to do with our organization, our training, period, end of story. And those are the facts. I'm sorry that might distort your what you're hearing on the media, but those are the facts, period.
Mr. Garcia, this is not something that I've heard on the media. This is actually the use of force analysis related to the death of Jamal Sutherland in the Sheriff Elkannon Detention Center, Charleston County Sheriff's Office, Charleston County, South Carolina. The author of this specifically has relayed to members of this board that the training that is referenced in this report is indeed your organization and your training. So that is not something that I heard from the media. That is from the words, the mouth of the person who did this report, a former sheriff.
Unfortunately, the hired consultant who did this report, understandably, did not have our full package, number one. Number two, he refers to his SOG in a general term. He doesn't say USC SOG because it's impossible to say that we trained the two officers, one, again, who failed our program, so of a 6-week program, was dropped on the 2nd week, and then number two, another officer who didn't even, was not certified, and plus was removed from the SOG team almost a year before that, and then pulled from regular duties to do unfortunately, a cell extraction. Number one, we don't use chemical agents, and you can look at all of our manuals. We do not endorse chemical agents on the mentally health. Do you know why? Because we don't know whether they're having a behavioral breakdown or a medical breakdown. Why exacerbate the situation? I established that within this community in 2016 on a paper with the National Sheriff's Organization. Number two, again, I don't know what the Charleston County for almost 2.5 years did when we terminated our contract, but here are the facts. In 2008, we started that contract to 2018, not one excessive use of force complaint, not one lawsuit, not one inmate killed, and not one officer injured. So it seems kind of odd that almost 2.5 years later, I would be removed, or we left the contract, and then we're to blame for something that we had no input in the training for 2 years, that they blended traditional cert and SOG, and they try to make their own program. It should be evidence that you should not deviate from a program that's already working. Thank you so much.
So I want to give I would like to give Ms. Wagner the opportunity to speak. She's the only one that has not had an opportunity to weigh in, and she's been very patient. So Ms. Wagner.
Thank you. I'd like to just start. I have a number of questions, both for Mr. Garcia and then also for the administration. But maybe if I start with Mr. Garcia. You and the jail have both referenced your 27 years of law enforcement experience. We have not received a resume or a CV. Is that something that you can get to us?
Sir, I did send one. Did I provide one?
I'm sorry, who's speaking?
So we will look into that. We will look into that, Ms. Wagner. I'll get back with you later to see whether or not I can get you that.
Well, let me ask Mr. Garcia then. Mr. Garcia, for your 27 years, could you, as we're all here, just detail your background, your employment background?
Yes. Thank you. I've worked for 4 major agencies, 4 major sheriff's departments. I've been, that's my.
Could you indicate them specifically, please?
Sure. Virginia Beach Sheriff's Office, Arlington County Sheriff's Office, Spartanburg County Sheriff's Office, and the City of Richmond Sheriff's Office.
Okay. And is that your full employment history for the 27 years, I would say, then dating back to 1995?
1992. And obviously working for the Corrections Special Operations Group as a contractor.
Okay. So what the information that we have then is that you've worked with 14 departments of corrections. Can you tell us the 14 departments of corrections that you've worked with?
Ma'am, I signed an NDA with every agency that I work with, so I would need to get permission to release those agencies just for a number of reasons.
Has the jail or the county administration been provided with that information?
You want to answer, sir?
We do have references of individuals of the correctional agencies that he's trained.
The 14 different corrections that are referred to?
We do have references, yes, ma'am.
There are 14, okay. So I presume then it was able to be provided contrary to whatever non-disclosure agreement Mr. Garcia is speaking of.
If I may clarify, I don't think the warden said he got 14. I believe he said he got references. He didn't put a number on it.
And my question, let me just ask my question. So let's not confuse it. I want to know if the county administration and or the jail has the 14 different corrections departments that are claimed to have been worked with. It's a simple yes or no.
And it's not a simple yes or no. What I can tell you, Ms. Wagner, is that we have the references. That's all I can say, ma'am.
Okay, well, in your information, Warden Harper, you have attested to us that exhaustive conversations with Mr. Garcia, referring to his 27-year law enforcement history, and also to 14 different departments of correction. We have viewed, not just in some wild internet search, as has been referred to by some other folks, but court documents, other verifiable documents that show concerns with those that we are able to identify. So I think that is very important for us as a jail board to understand which other departments of corrections beyond, for example, the one in South Carolina or York County, of which we know that we are talking about. I'd also ask of the administration and of the jail, it has been stated multiple times that there was outreach to other tactical training companies. Can you inform us which other companies have been contacted?
I can definitely do that, but I don't have that information available right now, Ms. Wagner.
Okay, when might that be able to be provided to us?
As soon as I possibly can.
Well, I think everyone's emphasizing the tight time frame here, so any approximation that you could give me would be appreciated.
As soon as I can, ma'am.
I mean, I don't think our board should be taking the approach as soon as we can. We'll review this, but I'll leave it at that. Mr. Garcia, we understand that the contract from Allegheny County was entered into on the 14th of July. However, we only have information of an insurance carrier for your organization beginning on the 22nd of July. I see Next First Insurance. Were you insured prior to that?
Ma'am, that's going to be a question for our administration. Yes, we were. So, but that's going to be that's handled by a different group.
Okay. And then I know you made comments about I'm going to add a few comments if I may at this point. So Mr. Garcia made comments about the South Carolina $10 million verdict that Ms. Hallam was speaking of. I know this was sent to our board approximately 3 weeks ago. Actually, I think 4 weeks ago, right after our last meeting. And the board did have the opportunity to review the expert report. I want to add, because that has come into question in this call, that Mr. Rainey, who's referred to as the person who did this report, is a recognized national expert in the use of force. My understanding is that President Obama, through Attorney General Holder, appointed him to the National Institute of Corrections. He is the VP of that organization that provides best practices in jails and prisons. So what I would like to ask, if we are going to be able to review this background, as I said before, I want to be able to see a resume and CV and information about the other departments of corrections, but I would also like this board the opportunity to hear from Mr. Rainey. And I would also say that to the motion that has been offered by Mr. Pilarski, when we are looking at this notion of a demonstration. A demonstration is but only one component. And my chief counsel, Mr. Kerensky, who is on this call, I think gave the best analogy when we were discussing this earlier today. If the county is engaged with an engineer and that engineer had a sizable lawsuit, for example, for a bridge falling down, we wouldn't say, engineer, we want to see a demonstration of how you build a bridge. We have very, very concerning allegations before us that a demonstration alone is not going to satisfy. So this board most certainly needs to review full information. And I would say a vendor of this magnitude of, these types of procedures within our jail is just as concerning if we had residents going on a bridge and we were about to retain a contractor who had serious allegations in that respect. This board is charged with protecting the health and welfare of our inmates. So I want to also say that the notions of this county administration towards the need for expediency, and I think this may address one of your earlier questions, Warden Harper, and I certainly want to say that I completely respect and understand how difficult the job is for your administration and for the employees at the jail. However, we also have a referendum from the voters of this county. And if the jail and the administration believes that it cannot safely comply with that referendum, I think your appropriate measure is to take that up in the courts, rather than bringing to us a sole sourced contract of which there are many credible questions, not simply wild internet searches. So just in closing for my comments, what I would like to ask is that this board reconvene. And I think given the time constraints, that is something that we need to do more quickly. I know everyone on here has very busy schedules. I would ask that we reconvene in 2 weeks. Mr. Garcia, I know I've asked you questions, but I do appreciate your attendance here today. And I would ask that both Mr. Garcia participate in that meeting, and that we also invite Mr. Rainey to participate in that meeting. Thank you.
Thank you, Ms. Wagner. So, all right, Ms. Hallam, just a couple more comments, and then I guess we can at least call for the vote on the motion. And I think depending on how the motion goes, there are some other things that I've heard that I think are important and that the board could request. But Ms. Hallam?
I appreciate it. I promise I will be brief. I just have a couple more questions. I know Ms. Wagner has brought up questions about the resume of Mr. Garcia. Mr. Garcia, have you served in the military? I don't think you signed an NDA with the military, so I figure it's okay to ask you that.
Ms. Hallam, we're not going to get into his history with the military. What we're going to do is base our opinion on the training that he's going to bring to our agency, the background checks that we did with NCIC, and he was cleared. Him clearing the background checks with 4 or 5 other agencies and correctional facilities throughout the nation and the world. So we're not going to talk about that.
Warden Harper, with all due respect, I do not believe, actually, I know it is not your decision whether or not I can ask questions and have answered to them as a member of this board. So I'm going to ask again, this question is directed at Mr. Garcia, not Warden Harper. Mr. Garcia, have you served in the military?
And again, Ms. Hallam, I'm gonna step in. He will not be answering that question, Ms. Hallam.
You are not an elected representative of this county. You are not a member of this board. And I'm trying to be respectful and patient and calm, but I do not appreciate you being an obstructionist in a very important line of questioning. If you are going to bring up his background checks if you were going to bring up his previous experience, if you were going to bring up his prior trainings, I am within my absolute right to ask him if he has ever served in the military. And the fact that you are so strongly dodging this question is very concerning to me. Have you served in the military, Mr. Garcia?
Can you answer that question, please, Mr. Garcia? I do believe it's actually a relevant question.
Yes, ma'am, I have.
Okay, and were you discharged from the military?
We're not going to answer that question, Ms. Powell. We're not going to answer that.
Again, Warden Harper, with all due respect, I really am trying to keep it cool here. Please, I am not talking to you. I am speaking to Mr. Garcia, who this line of questioning is about. It has his prior military experience truly is outside of your area of expertise. Warden Harper, I would like to hear from Mr. Garcia. Were you discharged from the military?
So, Ms. Hallam, this is what I would say. Because I think you're going to keep asking and the same thing's going to keep happening. So I think we should take a vote. Let me just finish on the motion. Depending on how the motion plays out, I think then the board has a right to request certain things, and I think we should have those certain things. And I do like the idea of Ms. Wagner having sort of an expedited board meeting for just just to deal with this issue. And then you can ask whatever you want to ask at that time.
Judge Clark, are you saying that I can ask Mr. Garcia in 2 weeks at our next
I'm saying you can ask him today. I don't have any problems with you asking him today, but I don't think he's gonna. I think they're not going to answer the questions. So I think we're sort of at that standstill, and I think we really need to move off.
Your Honor,
need to have the vote and go ahead. But maybe he will answer the question.
Mr. Garcia, are you going to answer my questions? Because if you're not, I would like to move on to the vote. Are you going to answer my line of questioning?
So, Mr. Garcia, go ahead.
I served in the military, number one. Number two, I never touted anything other than my 27 years of law enforcement experience. Everything else before that is private. It's a personal matter, and I will not answer anything about my personal life. I am sticking professionally with my professional resume. Thank you very much.
Okay, so part of my professional resume is that I actually was incarcerated. And so I'm wondering if, as part of your professional resume, were you ever incarcerated, whether in a military facility or in a civilian facility? Did you ever serve any time in a correctional facility?
So I don't think he wants to answer that now. And so I think we have to save that for later. There may be reasons that, for example, if somebody gets a pardon, I don't think they necessarily have to answer that. They could answer that. I think personally, I think it's relevant. I think we should move on from this issue right now.
Okay, so Judge Clark, can I just ask you then, when can we ask this line of relevant questions? Is that, I just want to make sure I'm understanding this thing that we're voting on. Are we now voting on a meeting in 2 weeks to ask relevant questions?
We're voting on the motion by Mr. Pilarski that was seconded by Sheriff Mullen to, I guess, to hold off on deciding about the seesaw contract until the board has had an opportunity to view the training for themselves. And there can be a motion. I think the board can decide. I do like the idea if the motion passes, I like the idea that Ms. Wagner had about convening sooner, so that, and then having a meeting that's solely for the purpose of deciding this issue. And there won't be any other issues on the agenda. It will be sort of a special meeting for the board to do whatever. But I don't know what the result of the motion is going to be. So I think we need to decide, because then we may get to another point. So that's my point. I don't think any more questions at this point is going to be productive. I guess that's mine. Miss Wagner.
Thank you, Judge Clark. Mine's not a question. I just wanted to offer an amendment based on the discussion so that we would also receive the resume and CV and a list of prior clients.
So that's what I was going to request on behalf of the board if Mr. Pilarski, if Mr. Pilarski's motion passes, is that we ask for those things. And I think the board has a right to have those things. So that was going to be sort of the next step. I don't know whether, I don't know that it has to be part of the motion or whether it would be a separate motion or whether, I think we can just ask for it. I think we should have it, so.
Okay, thank you. I'm happy with that.
And then Judge Clark, were any of the amendments that were mentioned by Judge Lazara or Ms. Klein?
Judge Lazara's motion, and I don't believe we ever got to the point where he actually said whether he would accept Ms. Klein's friendly amendment. I think the point that Chief Williams made about stopping the training, then we wouldn't have anything to watch. So I don't, Ms. Klein.
Since it was my amendment, thank you, Ms. Williams, for clarifying that obviously we can't watch a pause training. If I could clarify, my amendment would be that while we are watching the trainings, they are not implemented, and also that the jail would look at other contractors because we don't want to be behind the 8 ball.
All right. Mr. Pilarski, do you accept that friendly amendment?
I can say we wouldn't implement anything, but I think we've looked at, as I've said, we've looked at other contractors. The other contractors all have items that we cannot use and they use in their training. So to use them in training, I don't understand would be beneficial, and they would train us on things that we cannot utilize. And,
so is that a no, Mr. Pilarski? Is that a no, you will not accept? Can I also, I would like to propose another friendly amendment that, understanding that the training can continue, that we would go watch the training, we would be provided with all of the background information that we request, and that there be no implementation whatsoever until the board approves it. So that, it doesn't automatically, if this goes beyond December 6th, they automatically start using it. But there would be no implementation in the Allegheny County Jail until the board has had a chance to do its due diligence, which I believe is what Mr. Pilarski wants us to do. And I think we all want to do that due diligence. And I think that there should be no implementation of this policy until the due diligence is completed, no matter what time it takes. Understanding that there is a deadline of December 6th, because I'm sure that we can all, we all understand this is an important thing, and I'm sure we can all make sure that we can be present to do it before that time.
Your Honor, I don't disagree with you. And I'm not an attorney. You mentioned if this goes beyond December 6th, I don't know what the repercussions would be if we don't implement something beyond December 6th. So
you can implement something, but you can't implement this program. That would be my friendly amendment to you. And that's the only way you're going to get my vote. So I'm going to tell you that right now. You make your decision on whether or not you're going to accept it or not.
So we wouldn't implement forever. I mean, I don't know. Is there an infinite timeline? Or is there?
I think the board has a responsibility to decide something before December 6th. So I think that's it. But I guess if we come to December 6th, so we've already decided, we didn't take a vote on it, but I think we've decided kind of informally that we're going to reconvene earlier. So then we'll either have some other vote, and then so I don't know that I don't think that the friendly amendment is going to hurt really change substantially your motion, because we have to come back, and the board has an obligation too to make sure that the jail complies with the law. And so I think we'll be back. I can't say what the result will be when we come back. What the board might say, because there's still a proposed motion that could be presented at that time, or a different motion by Ms. Wagner or Ms. Hallam or any other person on the board. But I think the motion right now, as I understand it, is to let the board take the opportunity to view the training before it makes a decision. And I think then the board also wants to have certain other information about Mr. Garcia and so forth that is relevant to the board's decision making.
Your Honor, and I hear you, and I hear Judge Lazara, and I don't have a problem with, like I said, I just don't know what the repercussions would be if we don't implement something by December 6th. I have no problem until the board views it. I would accept that friendly amendment, but again, with the caveat that I myself aren't legally capable of saying what would happen beyond December 6th if we haven't implemented anything. That's all.
I think we all understand our responsibility is to make sure that the jail has some ability to use in situations that they will need to once this, once the voters, will has been imposed on the jail. But, I think that we have the right to make sure that there's no implementation of this policy until we've had the opportunity to do our due diligence. And, you said earlier in response to a question that it would automatically go into effect on December 6th. I want to make sure that that is not the case, that there's no implementation till this board agrees, with the understanding that we're going to do our job and we're going to make sure we do our job to not leave the warden, with no options by December 6th.
I certainly don't want to suggest that anyone on this board wouldn't do their job or wouldn't do the best. I just think we have to do our due diligence. And like I said, I accept your friendly amendment, and I'm sure there'll be plenty more discussions between now and December 6th.
So Sheriff Mullen, do you second the motion with the friendly amendment?
I do.
All right.
Judge Clark, can we clarify what we're voting on? I think you're about to take a vote. Can we clarify what the motion is with the friendly amendment prior to the vote, please, just so we're all on the same page?
So the motion was, or is, so let me get it right. That the board shall forego an action regarding seesaw training at the jail until each member of the board or in the alternative, members of the board designated by the chair has had the opportunity to observe a significant portion of the training at the jail so as to obtain an informed opinion as to whether such training is in the best interest of the jail inmates and personnel and is consistent with Section 205 and all other legal obligations and otherwise serves the best interests of the residents of Allegheny County. And in addition to that is that the training not be actually implemented, or the program not be implemented until the board has actually taken action on whether it should.
And that the information that the information is provided to us.
Okay, so just to sum that all up, if we vote yes right now in this vote that's about to happen, we are saying that yes, this training will stop until the board reconvenes to vote.
Training will continue because the board has to.
The whole point of this conversation was how horrible this training is. If this motion does not stop it until we vote yes or no on it, then all Mr. Pilarski's trying to do is last minute sneak in an agenda item after the agenda was set with a motion to try to stop this contract. And I just believe that's disingenuous, and we have fought against that.
That's your opinion, but okay. So we have the motion and we have the second. So I'm gonna, I guess, do a roll call vote so we know who's voting. Ms. Hallam?
Yeah, I'm gonna be a hard no.
All right, thank you. Mr. Pilarski, on behalf of Executive Fitzgerald?
Yes.
All right, Ms. Klein?
No.
Judge Lazara?
I'm going to say yes, because I think that something needs to continue while we're trying to figure out whether this is the right thing.
Ms. Moss?
I'm doing a yes.
Sheriff Mullen?
Yes.
And Ms. Wagner?
I am going to vote no, but I do want to acknowledge I appreciate the amendment and to specifically secure the resume and the prior corrections department with which this company has contracted. I believe we should have had that by now to answer the concerns that we've already had. So I look forward to receiving that as it looks that this will be carried as a motion. Thank you.
All right, so it's 4 yes and 3 no, so the motion is carried. And then I will send Warden Harper tomorrow a list of the things that we are requesting. And so, because we have to proceed with all due speed, so I would ask you to send me whatever it is you want, so I don't forget, don't leave anything out. And then I guess we need to work with the warden, or what I'll do is we don't all, I guess, have to go at the same time. Does everybody want to go? The motion also said the board chair can designate who wants to go. So why don't you email me if you want to see the training and your availability? I'm assuming that everybody wants to, yes.
Are we still debating Controller Wagner's motion about the meeting in 2 weeks? Is that something that's set, or do I need to second that motion and we have a vote on that?
I don't know that we actually need to have a vote on that. Does anybody disagree that we should not have a meeting in 2 weeks or close to 2 weeks? All right, so then because
may I just add one important point to that? I would ask that at that meeting that Mr. Garcia again be available, and that we also are able to hear from Mr. Rainey.
Right, so that what I was going to say is if I was going to ask Ms. Wagner if she would contact Mr. Rainey and see what his availability is. Since we're doing it virtual, it's a lot easier for people to participate because they don't have to travel anywhere, but I'd like to know what his availability is, and then we can set a date. So, you know, the time is sort of tight, so if you could provide me with that.
Absolutely.
And then I'll ask Wharton Harper to get some dates from Mr. Garcia so that we can then pick the same dates. And if anybody knows that they are not going to be available any days in the next couple of weeks because of travel or vacation or anything, would you please email me and let me know that? So I know I'm asking you to do a lot of things between today and tomorrow, but I don't think we have a lot of time to you know, with all fairness to the warden. I mean, it is difficult. We're going to have, if whatever is decided, then I think, you know, we need to act very quickly. So, all right. So I'm going to, because it is 6:10, we have some other items of old business, and I don't know whether, I think some of these can wait to the next meeting, such as the update on the Polycom policy, plans to resume visitations in the jail. I think it's fair to say that the numbers, looking at the numbers that are coming up every day, I think we can hold off on those things unless there's something there, Wharton, that you just want to tell the board with respect to those things.
You want me to?
No, ma'am. Hold on.
I can.
No, ma'am. I don't have anything, ma'am.
All right. So Deputy Warden Williams, you usually give a very detailed report on the COVID update, and I'm going to ask you if you could perhaps do that rather quickly, because we do have a number of public comments, and I do want to make sure that I get to some of them. A lot of them dealt with the seesaw contract, so I don't know that I'm going to read most of those, but I'm going to turn it over to you right now.
Thank you very much, Your Honor. So on the website, and we've updated it, it might be a bit confusing if you start to add the numbers together, and you would come with a total number of positive cases that is higher than what we've actually had. The important thing to note is that we do confirmatory testing for discordant results. So if somebody tests positive with a PCR test and they've not had any symptoms, we may be confirming that with a confirmatory test, which is the PCR. Or on the opposite end, there have been several times when we've utilized rapid testing with somebody who is demonstrating symptoms and they test negative. But we keep them isolated because they are symptomatic, and then we'll do a viral diagnostic test to confirm whether or not they're positive. So there are times when you see duplicate numbers, and I did try to separate them out within the data, as well as providing the look back. Instead of spending a large number of time on all of the total numbers, which are available on the website, I want to be mindful of time and focus on the fact that within the last month, we saw an enormous increase in positive cases, not just in Allegheny County, but in our facility as well. So in August alone, we did 3,976 rapid antigen tests. 3,701 of them were negative and 226 of them were positive. So you will see those case counts on the website. Presently, we have 65 individuals who are positive in our facility right now, and they are on our isolation units where we can meet their needs. We do have some on our medical housing unit that require additional monitoring. And then we do actually have 2 individuals who are presently hospitalized with COVID-19. So what has changed? Well, we're seeing a much larger incidence rate in recent admissions to our facility, which is reflective of the increasing rise in community cases as well. Through consultation with the health department, we recognize that the R0 of the original virus of SARS-CoV-2 was believed to be 2. The R0 of the variant Delta is perceived to be 5. And though we've not sent our specimens to the CDC to get those confirmed to be Delta, since we do know that that is the large presence of cases within Allegheny County, we believe that to be also the case within our facility. And the infection rate is 2.5 times more contagious than the previous strains. Additionally, we all know congregate settings are extremely challenging environments. And though we have the capability to cohort on our housing units, we may not be able to cohort individuals who are traveling off-site for medical procedures or to their legal obligations. This adds a layer of vulnerability to our institution that we did not see in the earlier phases of the pandemic. As everything has opened up, we have all become more vulnerable. Right now, I referenced that we have 2 individuals who are known to be positive and having their needs met in a setting that affords a higher level of care and monitoring. We're limited in the level of monitoring that we can provide on site. If someone requires continuous oxygen of 6 liters or more, they need to be transferred to a higher level of care due to a number of different medical concerns and complications like hypoxia. We don't want people to have negative events or even more negative events as a result of COVID-19. So it's important that we allow them to have access to higher levels of care to treat them. When indicated in terms of serious illness, we have also additionally enacted procedures to contact next of kin in order to engage the appropriate persons for the healthcare decision-making process. This is extremely important because if the person is unable to make decisions about their own medical care, we don't want to be the ones doing that for them. So we want to make sure that we're engaging the family members who are identified as next of kin so that they can make the healthcare decisions. I can say this is no small feat with our population and doesn't always happen at the most timely time. So I wanted to specifically thank the Office of the Public Defender, specifically Director Dugan, who has gone above and beyond to support our population and their families. During off hours, the Office of the Public Defender has been exceedingly responsive and available in assisting with collaboration with private counsel or submitting emergency court orders to increase coordination and communication of care for our patients that are in the hospital. They've been expeditious during times when it was most necessary and demonstrated their commitment to true public service. When somebody declines in health, we work very closely with the care team at the hospitals to make those decisions when we should be engaging others. And I'm very thankful that we have the relationship and the resources within Allegheny County that we can assist families so that they can be engaged at a very important time. Within our staff, we've had 162 positive cases and 9 individuals who are currently engaging in their recovery process and have not yet returned to work. I know that some of the public comments reference this, so I wanted it to be part of the presentation. That beginning August 30th of 2021, the Allegheny County Jail began surveillance testing on all employees, county and contracted, that present to the facility and have not demonstrated proof of vaccination. This surveillance testing is completed on a weekly basis. In terms of vaccinations, we have supported the vaccination of over 1,400 incarcerated individuals. We still maintain storage of Pfizer, Moderna, and the Janssen vaccine on site, and we're continuously offering these vaccines and completing vaccination clinics Monday through Friday. Presently, we have 814, or 48% of our current population who have received their full series. Of those, 691 or 41% have been vaccinated with the full series and have additionally exhausted their 2-week post-vaccination period. So we would consider them to be fully immunized within the facility. This is an 11% increase from last month's percentage reporting and is no small feat in a population that is constantly changing. So a lot of times we are the responsible entity for providing the second dose of Moderna or Pfizer when somebody has started that vaccination process in the community. That requires our healthcare staff to confirm what dose they may have received and when in the Pennsylvania immunization record, also known as PASIS, and then scheduling out appropriately when they would be due for their next injection, making sure that they have received all of the informed consent, and then providing the actual vaccination. We have, thanks to the board, continued to apply $25 to the accounts of fully vaccinated individuals from the Incarcerated Individuals Welfare Fund, with the exception of those that have been completed since August 27th of 2021. So that list keeps evolving and it is very fluid, and we continue to revisit that to make sure that we're applying those to the accounts. I'm certain there might be additional questions related to this, but I wanted to provide the bulk of the specifics in mindfulness of the time.
All right, Ms. Klein.
Question, do you know if any of the staff who you said tested positive, have any of them tested positive twice?
We have had staff that have tested positive on more than one occasion. We have also had staff who were fully vaccinated test positive. Though both of those rates are extremely low within our staff populations, they have occurred.
Ms. Hallam.
Yeah, going off that question, what is the protocol for, I'm just going to throw out a hypothetical. I'm a corrections officer, I am vaccinated, I come in contact with a COVID positive person at the jail. I test negative. What is the procedure for that? Am I still forced to take time off work? What is, if you could just speak to that.
So everything's going to be contingent on how the contact was actually defined. So a contact exposure could be an employee who maybe has their mask, just like mine is presently, around a known positive case, or they're not wearing the protective gear that would be most important, or they're around another staff member and they're not compliant with the protective measures that are in place. So if you're a vaccinated person, we would test you just to make sure that you are not also presently positive. You would quarantine for 5 days. As long as you do not develop symptoms and you continue to test negative, you're permitted to come back to work. We are definitely taking an abundance of caution because we are seeing breakthrough infections within the institution, that it doesn't seem to be a worthwhile risk to continue disease spread. So those are the procedures that we're presently following.
Okay, and for those 5 days that they are forced to quarantine, regardless of if they're vaccinated or not, are they paid for that time?
If they have benefit time available, then it is paid.
So they are not paid for that time. They must use benefit time that they have accrued for this mandatory quarantine.
Yes, ma'am.
Okay. And then my next question is, have any staff members that have tested positive for COVID been either hospitalized or lost their life to COVID? I know we report about the hospitalizations of incarcerated folks, but I'm wondering if that's ever happened with a staff member.
So I can't go into specifics related to personnel, but I can say that we have had several individuals who have had very severe expressions of the illness and some that have not returned to work. So out of respect for them, I would not want to comment on that further. We do have people who are aware that people have been out, and that is related to their protected health information. I wouldn't want to give that information in a public setting.
Can I ask what the difference is, why you were allowed to give that information about incarcerated folks, but not about the staff members?
So we're required to report on the hospitalizations of incarcerated individuals, I'm not required to provide protected health information of my employees, and I have a duty and obligation to protect them as well.
Do you believe that you are prohibited from telling us if any staff members in the jail have been hospitalized or lost their life to COVID?
I don't think that it's appropriate. It's not regarding whether I'm prohibited. I don't find it to be appropriate during this setting to discuss. It is possible that maybe during communications with the board, that might be something we could discuss in the future, but I would not feel comfortable at all in this setting.
Okay, well then I would like to ask that after this meeting is over, that you communicate to the board outside of this public setting whether or not any staff members in the jail have been hospitalized or lost their lives to COVID. Thank you very much.
Ms. Wagner, did you have a question or comment?
I did. Just a brief question, Deputy Warden. Are you all in preparation to administer the booster dose?
Yes, we are. So we have been in discussion too with our electronic health record vendor to make sure that we can accurately document this as well. Right now, we have a specific queue that we're working out of for vaccinations. But we've also been reviewing the individuals who would meet the criteria and making sure that once we hit that timeline of which they are eligible, that we would be providing that booster vaccination as soon as possible. Some of our staff are there at that point.
Okay, thank you.
Thank you. Any other questions? Thank you, Deputy Warden Williams. I always appreciate the detail of the reports that you give us. I know it's work to compile it, and we really appreciate it. And I hope the public appreciates it as well. Just a couple of things with respect to the public comments. We had a lot of public comments, and I want to thank the public for the comments and for expressing such interest in what I think are some of our most vulnerable citizens of Allegheny County, and that's people who are incarcerated. Many of the comments dealt with the seesaw contract in opposition of that. And then we had a number of comments. I have some comments. There were a few comments about conditions in the jail. And so a couple of comments about whether there was a lack of hot water. I don't know whether Warden or Deputy Warden Williams, I'm going to read the one from Alicia Turner, who says, how come these people don't have working hot water? They are still human regardless of the situation. As these are people's loved ones. So was there an issue with hot water? There was more than one comment about the water. Was there an issue with the water?
We did have an issue with the water at one time period, and that issue was addressed as quickly as possible. So there was an issue at one time, and it was addressed.
All right, thank you. And then there was another issue from Vanessa Thomas. Hello, my loved one mentioned fear of rodent droppings being in the inmates' food due to seeing roaches and rats in the kitchen. Will there be an exterminator to take care of this problem? This one also mentions the hot water. And then lastly, another loved one has been waiting to see a judge for over 2 years. What is the process of getting in front of a judge? So can you address the issue of about the extermination, and then maybe Judge Lazara and I could talk about the issue of getting their case to court. And it's been complicated, I will say, during COVID, and a lot of it depends on the reason that someone is there. So there's a number of factors. But can you comment upon the issue about any rodent droppings and things like that?
So the exterminator still comes twice a week, Your Honor. So that's still in progress.
All right. Has there been an issue that you're aware of recently with that as described in the comment, if you know?
I don't know of any rodent droppings in the food at our kitchen, Your Honor.
All right. And then we have a question from Rachel Green. I'm looking for clarification on why people are placed in segregated housing What must a person do, or what criteria must they meet to be placed in segregation? Who decides how long a person stays in segregated housing? And how often do they reassess the situation? I'm not exactly sure what she means by that, but I don't know if you can comment upon that.
Criteria for segregated housing includes anyone who is a threat to themselves and others, anyone that violates policies and procedures. The Program Review Committee determines how long an inmate remains in segregation. Reviews are conducted every 30 days.
And then there were a few comments on the NCCH review, and specifically on inmates who are withdrawing. I would suggest that since we did not have, we didn't go through that report at this hearing and an update, I'm going to ask that we hold these comments for the next board meeting, and that the warden gives a full update, because I think at the last board meeting, and there were some questions about, you know, do they come back in and reassess and those kinds of things. And I think that would be appropriate to have some discussion at our next board meeting about that, because I thought those were good, legitimate concerns. And then lastly, there were a number of questions in the public comments about the closing of Shuman Center. And I would just have a couple of things to say. That this board doesn't have anything to do with the closing of Shuman Center, but some of the comments expressed concern that the closing of Shuman Center would result in juveniles being detained in the Allegheny County Jail. I can say that is not the case. The statute, the juveniles that are in the county jail are there because they are charged as adults under the statute. So they are not charged as juveniles. Juveniles who were charged with delinquent offenses cannot be housed in a county jail. They can only be housed in a detention center if the court determines that they should be detained pending a hearing on their case. So the statute is, well, juveniles that are charged with homicide or murder, regardless of age, are charged as adults. Those cases start as adults because the crime of murder was excluded from the definition of delinquent offenses. Other juveniles that can be charged as adults are those who are 15 years of age or older and have committed one, or are alleged to have committed one, of the serious felonies: rape, involuntary deviant sexual intercourse, felony 1 robbery, kidnapping, carjacking, and some others, while in possession of a deadly weapon. And some of those juveniles, many of the juveniles that are charged as adults, are not detained. They get bond. And the ones that are detained can petition the court for transfer of their case to juvenile proceedings. If the court grants that, then they would be released from the jail and detained somewhere else if the court determines that they need to be detained. I have great faith. The statute is very specific as who can be charged. I have great faith in the district attorney that they're not going to try to trump up charges just to put juveniles in the jail or detain them. And there are a lot of efforts happening in Allegheny County with the cooperation of the district attorney and police departments all over the county to actually divert more cases from the filing of charges. I think it's about 40% of the cases get some kind of diversion. Some are diversion without any charges being filed, where police can divert. Some are, the Juvenile Act allows for the probation department to adjust any case without the filing of a petition. And so if the juvenile completes some community service, then no charges are filed and the record is expunged. So that will not result in the increase of juveniles being detained in the county jail. So I just want to say that, and as a judge that works there and has worked in the juvenile court for now 22 years. And so with that, I'm going to move to new business, and I know that we have Ms. Hallam's motions.
I'm sorry, before we move on to my motions, I just I have some concern about the public comments. So this month, Something new happened with public comments where now the folks who are submitting public comments are limited to 750 characters in their.
That's been for a while, Ms. Hallam.
And why was that implemented? Because I'm worried we're not reading comments, we're limiting comments, and now we're just straight up excluding a lot of comments. And I'm just kind of concerned how the public.
Because we get sort of 50 comments, many of them, I try my best to read as many as I can. When we first started this process with the virtual meetings, I actually did a practice run of how long to try at my quickest reading of them to read the comments, and it took over an hour to read the comments, and that's with no discussion. It's just me reading that with my stopwatch there, going one right from the other. There was one occasion where I actually wrote answers and had them posted on the website. I try my best, but many of them are the same. People raise the same issues, so I try to pick one or two that are representative of them. I don't know any, if you have, I'm open to suggestions from the board as to how we can do this better. I really do appreciate the comments. And so you all get the comments. You get every one of them. If there's a comment that in particular that you want read at the meeting, all you have to do is tell me, Judge Clark, please read this, or you can read it yourself. If there's something that you want to make sure is answered, you can do that. I go through them, and so sometimes I ask so that we're prepared to have some discussion. I ask the warden or Chief Williams, can we be sure to try to answer these? But the meetings are lengthy, and we just can't get to all of these written comments. I think we got close to 50 this time. I think when I count it. That's a lot. And if we took 2 minutes on 50 comments, just reading them, that's 100 minutes. I don't know any other way to do it. So if you all want to put your thinking caps on and figure out a better way to present these at the meeting, I go through them. I read every one of them. There's not one comment that I don't read. My staff compiles them, and my secretary sort of groups them in categories with headings so I know what they are. I blow them up so I can read them easily at the meetings. I highlight the things that are questions. Some of them are truly comments and they're not really asking questions. Some of them are. I did not read, because we had a lot of discussion about the seesaw contract. I did not read any of those comments. That doesn't mean that we're not thinking about them. And if you want at subsequent meetings, you can ask me to read one and I will do that. Or you can say, yes.
My next question was going to be, since this is not a regular meeting, this emergency meeting we're having in 2 weeks, but it is a public meeting and it is specifically about the seesaw contract, I would like to ask that the comments about the seesaw contract that were not read today, if we could instead ensure that those are read at the next meeting, because I do know that there were a lot of folks who reached out to us about that. And since
so what I would do is I would ask the board to go through them, because many of them raise the same issues. So if we have 20 comments that essentially say the same thing, I don't know that we would have the time to read 20 comments. So if the board wants some of those comments read, I'm fine with that. So I'm going to ask you to go through them and decide which ones you think should be read, because some of them, they raise a lot of the same issues. They raise a lot of the issues that you raised in your questions and comments today. So that's the best I can tell you.
And Ms. Hallam, I'd really like to have that meeting be so that we can really talk about and talk with the experts, about this contract and really be able to go through. Not that the comments aren't important, but we do all get them. I know that I read every single one of them before every single meeting, and I just think that it would be really important for us to have as much time as possible to really talk about the issues and ask questions of the expert that's coming, and to ask questions of Mr. Garcia so that we can have a really fully informed decision.
Yeah, no, and I totally understand what you both are saying. I guess my concern is just that I don't want us to ever get to a point where we're discouraging public participation in our meetings because people are putting a lot of time and thought into their public comments and then we're just skipping over them. So I guess this would be a good time to just say, if anybody's watching the meeting, if you have an idea for how we can best handle public comments, you can email me. I will compile any suggestions and forward them along to the board. I do think we need to find a better way to handle participation from the public in these meetings, because I know a lot of folks are very frustrated that they are not feeling heard, especially folks who either work in the jail or have loved ones in the jail or folks who are incarcerated themselves. So if anybody has ideas on a best way for us to, in a time condensed fashion, address all the public comments we get, please email me, slide into my DMs on social media, whatever it is. I just want to find a solution for this.
But I do want to say, I do appreciate the comments, and I know some people feel like I don't. I've read that some people feel like I hate the comments. I don't hate the comments. I really appreciate them. I think the public should be able to weigh in on them, and I do read every one of them. And the board, I reads every one of them, and the public gets to see them too, because we post them on the website. So people can read them. It's just that there's so many of them, and the board, this board is a very busy board, and there's a lot of business that we have to do. And unfortunately, I have not been able to figure out a way. I mean, I thought in the beginning, I thought I did a good job of sort of grouping them together and picking the comments that were representative. If there were 10 comments about the same thing, picking 1 or 2 that were representative. And I know some people feel that that upset because I didn't read their specific comment. And I understand that. I don't know that I would feel any differently if I took the time to submit a comment and then mine wasn't read. I don't know, but I don't know a better way to do it given the constraints of the meeting. So, but I just want the public to understand, I do really appreciate the comments and your interest in what happens at our county jail. And I just want to make sure that people understand that.
Thank you, Judge Clark. And then before I present the motions, I just realized one thing was missing from the Deputy Warden's report, the update on the plan for medications for opioid use disorder. We were supposed to get an update on the implementation of that, and we just didn't get it.
So it's not that I skipped over it intentionally. I was asked specifically about COVID, but I do have those numbers.
Thank you.
So we have 46 individuals who are presently incarcerated and prescribed buprenorphine. From August 1st to the 31st, 88 unique individuals were prescribed buprenorphine. We've been working to partner with other agencies. I know we talked about this last month, but we've been doing it even more so this month. As a mitigation risk factor, transferring between county jails has become, slower. And some of those facilities cannot accommodate medications for opioid use disorder. So we've been working with video arraignment whenever it's legally feasible to meet their legal needs while also providing the medication while they're here. Lastly, we are working to source a pharmacy that's able to provide Sublocade to our facility. Sublocade is an extended release injection for buprenorphine that's given one time monthly, whereas oral buprenorphine is administered daily. And the reason why this is important is we're seeing a lot of people in the community who are stable on Sublocade, and that's their preference. It meets their recovery needs, and we want to continue that. We just don't have the capacity to do so right now. So when they would be due for their next injection, they are transferred to an oral buprenorphine, which is obviously not necessarily what they're used to in the community, but that's all that we can do at present until we get those resources.
That sounds great. It sounds like the numbers are ticking up, so I'm very glad to hear that. And then any update on the implementation of methadone?
Unfortunately, we've not been able to make progress with methadone.
Okay, but that's still in the works?
Absolutely.
Okay, thanks. All right, Judge Clark, I'm good to go for new business.
Because I had said that Ms. Thompson's comment about someone who had been waiting to see a judge for over 2 years. Ms. Thompson, if you're listening, I'm going to, because you have your email address in your comment, I will email you to get more specifics to see if we can figure out what has happened. because it's pretty general and there's so many reasons that could have happened. So you'll be getting an email from me requesting some additional information. All right, Ms. Hallam.
Okay, so the first motion is a motion to request money from the Incarcerated Individuals Welfare Fund to be put on the commissary accounts of each person in the ACJ. At the time of my drafting of this motion, there were 1,759 folks incarcerated in the jail. At $50 per person, it's a total cost of $87,950. So I would like to move to approve that.
So second.
All right, it's been moved and seconded. All those in favor?
Aye.
Any opposed? All right, the motion is carried. Ms. Hallam.
Much. The next one is a motion to request money from the Incarcerated Individuals Welfare Fund to be put on the tablet accounts of each person. Again, there are currently 1,759 folks incarcerated in the jail, $50 for each person, total cost of $87,950. I would like to move to approve.
Second.
All right, Ms. Moss, second. All those in favor?
Aye.
Any opposed? All right, the motion is carried. Any other new business for the good of the order today? All right. Yes.
Just, I'm so thankful that we do that, give the incarcerated people money. But just to put that in context, one motion would be more than the cost of the liaison. And we do 2 times that every month. So I hope that can allay some of the concerns about this expense to the Incarcerated Persons Fund.
And remember, with that, Terry, the fund still doesn't fluctuate. It still sits at over $2 million every month. So you're right. That's a good perspective.
I think
So it wasn't the money that was complained about. Ms. Moss, did you want to say something?
It's just, this kind of brings back memories, but this is their money. And I don't think that we should be paying out of their money someone to come report to us. That's my problem. I think there should be some way that we have money to pay. I don't think it should come out of their families' money, their people that pay to send money to give them to buy all that very expensive commissary. And then we're going to pay someone to, that's my reason.
Well, the board voted. So.
That's why I said I couldn't, I see this nightmare. I saw it before, buying uniforms and all that. No, they need somebody.
But that's not happening anymore. So that's a good thing. So it's progress. We'll take it. All right. Any other new business? All right. Before we adjourn, please, as soon as you can, get me the information that you want me to pass on to the warden so we can move forward. And if I'll entertain a motion to adjourn at this time.
Second.
All right. I think we had a motion, Ms. Moss, and a second by Ms. Wagner. So we are adjourned. Everyone, please, please, please still be careful. We're not out of the woods with COVID, as you know, so please stay safe. And if I don't see you before tomorrow, have a wonderful holiday. We have a holiday weekend coming up, but be safe.
Bye, guys. See ya.
Everybody be safe.
Bye.
Bye-bye.